Sagging skin, sun damage, or fine lines can make you look older than you really are, but now there's a new option that could help you turn back the hands of time and give you a more youthful appearance. Dr. Robert Langdon is the medical director of the Langdon Center for Laser and Cosmetic Surgery, and he's back to talk about ThermiTight. Doctor, nice to have you here. So let's talk a little bit about the procedure. It's non-invasive.
Right. ThermiTight is a technique where we are using it's actually an electrode, a very thin instrument that is placed below the surface. Mm-hmm. So first you have to numb the area.
Okay.
And we make small incisions to go through the skin. The ThermiTight uses radio frequency energy, which results in a heating effect within the fat layer or right below the skin. And that heating effect will cause some immediate tightening, but there's also a longer-term effect for a period of a few months where the skin will continue to shrink.
Wow. So, and you said minimally invasive, so just a local anesthetic. So do you still get great results?
Well, it won't do the same as, say, a facelift, mm-hmm. but in certain areas, the most common area that we treat would be the neck and the lower face. Mm-hmm. It can be a pretty impressive result, almost without doing surgery. So when we say minimally invasive, as opposed to non-invasive, mm-hmm. would be where something is simply put on the surface.
Sure.
But with minimally invasive, it's actually more effective because we go below the surface.
I understand. And you said you did it on the neck, on the chin. Any other place you could do it?
We've done it in a variety of different areas, and wherever a tightening of the skin would be helpful. Mm-hmm. Quite often the abdominal area can be done if the skin is excessively wrinkly. Even the area above the knee, which can be quite a problem with other, not too many options for treating that.
Sure.
And in addition, we've used it for the breast. Usually combined with a breast reduction where we would do liposuction to remove excess fat, but to get an extra lift effect, the ThermiTight can be used.
Well, you always bring along some great before and after pictures. We have some here today. If we could pop them up on the screen. Just explain to us what we're looking at, Doctor.
This is a patient that has actually a pretty significant amount of fat in the area of the neck, especially below the chin. Mm-hmm. And also some prominence in the jowl, which is the lower cheek area to the side of the chin. So in her case, we combine liposuction of the neck and the jowl area with the ThermiTight. And we're able to use the same small incisions that we use for liposuction in a case like this. Someone that would have less fat may not even require liposuction, and it would just have the ThermiTight delivered. So here she is.
Wow.
This is about 2 months later, and we've had a very significant tightening. Some of it is certainly the volume reduction from taking the fat away with liposuction. Mm-hmm. But a patient like this, where we would consider a facelift as an alternative, which is certainly a much more invasive procedure, we can do at least in the neck and lower face, we can get some of the results, without the
yeah, those are dramatic results. She looks great.
Surgery.
We have another patient of yours, a similar procedure, I would say.
Yeah. This is actually a plastic surgeon in Missouri who did this one with the ThermiTight. And same concept. In this case, not as much fat. So here, a patient like this, the ThermiTight alone, which will also, in addition to causing the tightening, it will actually melt fat cells. And the fat tissue can actually disappear on its own without having to do any removal.
Mm-hmm. Doctor, tell us some of the safety features of ThermiTight.
Well, I mentioned that the radio frequency energy generates a heat effect. And heat is good up to a point, but too much heat could cause problems. It could actually cause a burn. So the ThermiTight actually is the only system of its kind where there is a tightly controlled temperature. Mm-hmm. So it uses a device called a thermistor, which is constantly monitoring the temperature. And as we do the procedure, we actually are getting feedback for what the temperature, exactly where the electrode is located, what the temperature is in real time. And the device also will, it's almost like a thermostat. It will turn off if the temperature is getting too high. And what we're doing also is distributing the energy throughout the area that we are doing. So there's a little bit of a back and forth motion of the electrode. And on top of that, we have another very sophisticated method of monitoring temperature, which uses an infrared camera, which is actually looking at the skin from the outside. And and then it's done wirelessly, so we actually can see the image on an iPad.
Wow.
But that's another safety feature to make sure the skin temperature stays...
Doesn't overheat or get too hot.
Doesn't overheat. We like it to go to a certain level, but not to go above that level.
Dr. Langdon, you have an upcoming seminar on September 19th. Tell us the details, please.
Yeah, so this would be one of our seminars. This will be comprehensive, where we cover lots of other procedures that we do, surgical and non-surgical, and one of the topics will be the ThermiLift.
It's a good place to ask some questions if you have them.
Exactly, yeah. So people are able to ask their own questions, and most people find it very educational.
All right, so it's September 19th at 7 o'clock at your office in Guilford. Let's put that information up there in case you missed it. You can call 866-967-3855 or visit langdoncenter.com. Doctor, as always, thanks so much for being here.
Okay, thanks.
All right, up next, how you can help in the fight against hunger when Style returns. We'll be right back.